Hi, I hope you enjoy this video segment that we've added to our website. Recently in the media there have been reports on studies showing that calcium supplements can increase the chance of stroke or heart attack. And I definitely think these studies and the way they're presented are somewhat misleading, because the problem isn't calcium per se, the problem is lack of magnesium. See, calcium and magnesium share this kind of offsetting relationship in the body, where, for example, in muscle, calcium is responsible for contraction and magnesium responsible for relaxation, or across nerve cells, where magnesium acts as a natural calcium channel block and regulates the amount of calcium that's allowed into the cell. So when somebody is deficient in magnesium, there's much more of a tendency for calcium to precipitate and move into soft tissues, at which point the tissues harden. So it needs to be pointed out that even if you're not taking supplements, these calcification syndromes can occur, because if your blood levels of calcium drop too much, the body secretes what's called parathyroid hormone, or parathormone, which goes to the bone mass, breaks it down, and releases large amounts of calcium into the bloodstream. And then, as I said, if you're deficient in magnesium, that calcium has a tendency to move into soft tissues. So it needs to be pointed out that in this regard, supplementation may actually be beneficial, because by preventing your blood levels of calcium from dropping too much, it prevents these large releases of calcium from the bone mass. So at Optimum Health, we have always recommended at least half as much magnesium as calcium, if not 2 parts of magnesium for every 3 parts of calcium. By far my most common recommendation is the same amount of both, or a 1-to-1 ratio of calcium and magnesium. So I don't think the problem is the supplements. The problem in the real world is health professionals who don't understand the interdependence and interrelationships between the nutrients and make recommendations like take 1,500 milligrams of calcium, add vitamin D to it, and don't worry about magnesium. So I highly encourage you to read this month's article, because for those of you who are scratching your head saying, geez, am I really doing the right thing by taking calcium? Hopefully this will put it to rest and show you what may be necessary for people to get the benefits from calcium supplements without any of the detriments. So I hope you enjoy. Thanks.